Okay, what you see are these little spider veins here across the top of your thigh, but what's causing these, shut off the light, are these veins that I can see with this loop here, see?
Mm-hmm.
All of this.
Okay.
And it's emanating from the top of the knee. There's a vein that comes out of the knee and then sprouts this underlying hose system which finally surfaces like sprinkler heads on a lawn.
Okay.
So we're going to inject this away today.
Okay.
Okay, and massage it through, and most of what I inject here should close this down, and what doesn't, next week we'll finish off with a few injections there. And that's it.
Okay.
Alright, as I mentioned, we're going to inject the underlying veins with medication to close them down. This is called sclerotherapy. And I'm using this fiber optic loop to illuminate the skin so I can see the vein deeper inside that wouldn't be visible just looking at it visually with room light. Now we're going to begin the procedure. I'm flooding the whole area, the whole venous tract with medication. Come up further. Let's see where we are here. Now I'm in, and now I fire again.
You okay? I'm swell.
Every time I put that needle in and draw back, as long as I'm getting blood in the tubing, I know I'm in the vein. I don't want to be in the skin. Now forward. Just going to look around and see if we have any other branches as we ascend in our injections. Take this one. Now that we've injected the underlying veins, we'll address the superficial veins that the patient came here to treat. It's just a tiny bit of medication in each injection. How uncomfortable is this?
Not at all.
But when you address these superficial veins, you always have to inject away the underlying issue first, otherwise the veins are doomed to return. Now, when I examine my patient before doing make sure they don't have a deeper problem. That's where other procedures like endovenous laser, ablation of the vein, or ambulatory phlebectomy come into play, and you'll be seeing those procedures too. Again, it's just a very delicate, light injection of medication into those veins. You can't get into the skin. If you inject into the skin, you'll ulcerate the skin. The lining of the vein is strong enough to withstand the corrosive action of the medication. Now you'll note redness or erythema where we injected before. That'll go away in a couple of hours. What we're doing when we inject is inducing an inflammatory response inside the vein. By inflaming the walls of the vein, we cause the veins to constrict and then consolidate. So what was once a tube becomes a ribbon that blood can't flow through anymore. As an aside, those underlying veins in the thighs are usually the cause of cellulite in women. So by getting rid of the underlying veins that we injected before with the loop and touching up with this, my patients told me over the years, not only did you get rid of my veins, but my thighs are much smoother. I don't have the lumpy, bumpy cottage cheese anymore. So in treating those underlying veins and the spider veins, you get a 2-for-1 benefit. You get rid of the visible veins and you get rid of the underlying cause of cellulite, so you get a smoother thigh. Everybody always asks, what about laser for treatment of spider veins?
I had the laser, and I thought the laser
That's
was
painful.
more uncomfortable because you feel that snapping. It was.
Yeah, that's like snap each time it hits the skin. But within 3 weeks from these injections, all these veins are gone. So So it's a cheaper procedure, it's less painful, and it's faster. It's effective 99% of the time, whereas laser is only effective about 40% of the time. Because with a laser you can't get the underlying veins. Laser is great as a resurfacing tool, to smooth out skin. But for the most part, I'd rather do inexpensive chemical peels on people to rejuvenate their skin. Nice thing about doing sclerotherapy, from an injection here, I can spread medication far beyond. Whereas with a laser, you have to hit the vein step by step by step. I just want to make this really perfect for her. This was really a quick one office visit deal. We'll see her in a week, make sure she doesn't have any congealed blood in the veins, and if she does, numb the skin, pinprick, squeeze out the blood, and send her home with a little Band-Aid on that. But she'll be ready for shorts in 2 weeks. Perfect, right?